Hello and welcome. Thank you for allowing us to record this session for use of medical students. Now, to begin with, I would like to do a general analysis of your face. So, to begin, I must ask you to hold your head as steady as possible, but hold a natural expression. For this part, there is just the examination of facial symmetry and analyzing contour lines to take note of any abnormal or noteworthy features that might be relevant at a later point. Now, forgive me as I will be getting a bit closer with some analysis. Things seem all in check. Skin is very healthy, not many blemishes, if any at all. So, moving on, I'm going to be doing a basic, bit more of a personal, but basic sensory test. So, if you would, again, please remain relaxed, as I will be touching various parts of your face. If you don't feel my touch, please raise your hand. Now, very good. Towards the end there, I did some dual touching, sort of both sides of the face at the same time. I'm going to go further in depth with that now, and if either side feels any different, raise the hand corresponding to that side. By different, I mean either weaker or stronger sensation than the other side. Good. Now, next, I will be pulling out a small but pointy object. It is not very sharp. Please feel it with your finger. It is going to feel like a slight prick, but my goal is to ask you whether you are feeling a sharp or soft object. Now I'm going to say what it is, and if you feel like it is not what I say, please raise your hand. So close your eyes. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp. 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 Soft. 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 sharp, soft, sharp, sharp, soft, sharp, and soft. Very good. You may open your eyes now. Now, next, if you could give me the palms of your hand face up, right hand first. I'm just going to run along the tip of your hand, or the palm of your hand. Very good. Each finger. Good. Other hand, please. Very good. Now, please rest down. Rest your hands. So, moving on, I'd like to do a basic reflex check. So, I'm going to be, well, first of all, I ask that you hold your mouth open, sort of in a resting position. And I'm just going to gently tap on it with my finger, or tap on your jaw. Very good. Now, please focus directly on my nose. Very good. Now, please open your jaw and don't let me push it upwards or closed. Very good. And now, keep your jaw closed and don't let me open it. Very good. Now close both eyes. This might feel a bit uncomfortable, but I will try to gently force them open. Don't let me. And very good. So, moving on, can I have your right hand? Other way around, please. Please curl your wrist up like this. Okay, and don't let me pull it down. Very good. Now the other way. Like, that works. And don't let me pull it out. Very good. Other hand, please. Don't let me pull it. And now invert. Very good. Nice. So, moving on. Now, I'd like to do a more personal inspection, more close up. So, if you would please follow my finger with your eyes, holding your head steady. Now, usually that would be enough, but for extra depth, I'd like to go a second time. So, once more, please. Very good. Now keep focusing on my finger. I'm going to bring it closer to your face. Now try to converge on it as best you can. Report any double vision. Well, once more, please try to converge. Okay, so there is no convergence there. That is perfectly alright. We will take note of that and look into it deeper in a future visit. Now, moving on, I would like to inspect your pupil light responses. Now, this light is a little bit bright, so it will be a bit uncomfortable, and so please forgive me. Now, looking straight ahead at either my nose or a point behind me, I am looking for a pupillary light response. I am not seeing much of anything, which is a tad bit worrying, but that is okay. I will look for a consensual response in the right eye. Again, a little bit worrying, but once again, I will try the other side. No direct response here. Okay, now I'm going to try for the consensual response. As expected, nothing. A bit worrying. Would you mind looking at my flashlight and following it? I will make a note of that. We will visit that more in depth later, but for now I'd like to finish the basic assessment. So I'm going to pull out this occluder. It is a eye chart. On one side, I will show the camera. A point for focus, but we don't need that today, as the finger has done just fine. And a scaling chart for your pupil size. So please look straight into this eye. About 4 mil. And again 4 mil. Very good. Now I do not expect much of a change, but I will, for the sake of testing, shine a light in your eyes again. Please bear with me for a moment. Very good. And as expected, no change. So, moving on. Actually, I'm going to keep the occluder out. If you would, could you read down to the green line for me? Let me know if there are any difficulties by raising your hand. Very good. Now, I would like you to focus on my nose. I will do an occluder check. Now focus on my finger. Now my nose. Finger. And nose. Very good. So I would like you to so I'm going to wiggle one finger, point at which one is wiggling. Please focus on my nose. Very good. Now, once again. Very good. Nothing seems out of order there. I would like to perform a few more checks just to focus on that one issue we had earlier. So, looks like we will have a use for this focus point. If you could please focus on the point, and does it look sharp and clear to you? Okay, now I'm going to introduce in a bright light. Let me know if it becomes more blurry, you're seeing double, anything like that, as I start to bring it closer. So you're seeing double there? Right around here. What about without the light? Okay, so it seems a bit closer. Good to know. Now, thank you very much for participating today. This has been very informational for the medical students who will be watching this. However, I would like to ask you to come back in for another visit at a later date to go deeper in depth and have a more profound analysis of these issues. Thank you very much, and I hope you have an amazing rest of your day.